Ladies and gentlemen, thank you for your patience in holding. We now have your speakers in conference. Please be aware that each of your lines is in a listen-only mode. During today's presentation, if you have a question, you may type your question into the chat pod located to the right of the presentation. It is now my pleasure to turn today's conference over to Chris Hund. Sir, you may begin.
Thanks, Brandon. Hi, everybody. This is Chris Hund, Director of the National TeamSTEPPS program. I work with the Health Research and Educational Trust. We're a part of the American Hospital Association, and so we're here bringing you this webinar today thanks entirely to the funding of the Agency for Healthcare Research and Quality, which is a part of the Department of Health and Human Services. So many thanks to our project officer, Barbara Bartman, and the rest of the team at AHRQ. But thanks for joining us today for our November webinar, Integration of TeamSTEPPS in a Clinical Practice Using Non-Traditional Methodologies. We have got a team here from both Nemours and Florida Hospital, so I think it's going to be great. I think you're really going to enjoy this today. They're a fun group. And you yourselves, thanks for all joining. We have people really from around the world today. I've seen people come in from from Japan, where I saw it's 3 a.m., across the United States, Puerto Rico, Germany, Abu Dhabi, Saudi Arabia. So truly, really exciting to have you all on board today. Thanks for all joining us. Some of you are going to be very tired tomorrow morning, I think. Just some rules of engagement here as we start off. You could access the audio for this webinar in two different ways. You can do it through the telephone, and if you're going to do that, you're going to want to mute your computer speakers. So if you don't mute your computer speakers, then what's going to happen is you're going to be hearing a lot of feedback throughout the course of the presentation. So make sure you do that. If you don't want to call in through your telephone, you can listen through your computer speakers. So that's the other option. There will be a Q&A session that we're going to hold at the end of the presentation, but please chat in your questions in the chat box throughout the course of this presentation. What we'll do is, as we go, if there are logistical questions we can answer, if you're having trouble with the technology or have another question, please shoot the message there. If you have a question for the speakers, also shoot the message there. If they have the opportunity, they'll answer it. If not, I'm going to compile all of the questions and try to put them in a reasonable order that makes sense and is logical for the end of the presentation, and we'll do a little moderated Q&A then. So that's how we run things here, and so we really encourage you to, if you think of something, chat that in over on the right-hand side there. Also keep an eye on the chat box throughout as well, because we'll be dropping in different URLs or other types of things that might be useful to you. I wanted to talk a little bit about some of the upcoming TeamSTEPPS events. What we have listed here all has some hyperlinks, and that will all go to the page we're talking about. So after this presentation, when you download these slides, these links are all right here for you. Master training courses, TeamSTEPPS master training courses. Registration is open for courses from January through March of 2017. These courses take place around the country at 7 regional training centers, so hopefully there's one near you that's easy to go to. We also have advanced courses. These are courses that are through application only, and they're really for individuals who are a little bit farther along in their TeamSTEPPS process. They've already implemented something in their hospital, and they're looking to make connections to a larger TeamSTEPPS picture and looking to make connections to other things like HROs and other kinds of types of initiatives you might be dealing with every day. And last but not least, our national conference for TeamSTEPPS. Registration's open. It's going to be at the Downtown Hilton in Cleveland, Ohio, June 14th through the 16th. As a person from Chicago and a Cubs fan, it's going to be very exciting to go to Cleveland, as it's the site of a very great event for all of us Cubs fans recently. We also have a call for proposals up right now, and we are actively asking everybody in the community to submit a proposal about what you're doing with TeamSTEPPS or how you're teaching TeamSTEPPS, and we really look forward to our conference every year as a place where we learn about all kinds of new information about what's going on in the TeamSTEPPS world. We have a helpline. If you need any assistance, you could either phone us or email us. We try to get back to you as soon as possible, within a day. We definitely are there to answer questions about the program, but also about TeamSTEPPS in general, if you have any questions about TeamSTEPPS. So shoot us an email or give us a call. I had said that the national conference was something that was really, really exciting for us because we get to meet new people and learn about new TeamSTEPPS ideas. And that can't be more the case than today with our three presenters who came down and presented to Washington, D.C. At the Washington, D.C. TeamSTEPPS National Conference last year. So I'm very excited to have them here to share with you. Their session, I think, was probably the most fun I've ever seen anybody have at a conference. There were all kinds of games going on. There was things in the hallway. We even got shushed by other people from other conferences that were in the same space because we were having so much fun. So great to have them here. So we have on the call or the webinar today Kelly Carlson Eberbach, who's clinical nurse educator at Nemours Children's Hospital. Daniel Franceschini, who is simulation educator at Florida Hospital, and Shiva Kalidindi, who is an education director also at Nemours Children's Hospital. So the three of them, I think, are going to give you a lot of great information today and are going to be here to answer questions afterwards. So without any further ado, I'm going to turn it over to the team. Feel free to get going, guys.
Hi everyone, I'm Kelly Carlson Eberbach. I'm the nurse educator, like Chris said, in the emergency department at Nemours Children's Hospital. And together with my team, we became master trainers about 2 years ago. Dan?
Hi, my name is Dan Franceschini. I am a simulation educator at Florida Hospital here in Orlando, Florida. And most of my career spends about 30 years. Actually, next month will be 30 years in healthcare. Most of it with emergency services and pediatrics.
Hi guys, this is Shiva Kalidindi. I work closely with Kelly and Dan, and together we are truly an interprofessional team when it comes to education here in our hospital and in the Central Florida area. We try to promote as much as possible interprofessional collaboration and education together. As you can see, I'm the guy with an accent. I'm from India, and I practice pediatric emergency medicine here, and enjoy being an educator and working with my colleagues to be able to promote interprofessional education. So we are so glad to be sharing this with you, fellow educators and trainers as well. And we thank AHRQ and TeamSTEPPS for giving us a platform to do so.
Okay, now on with the formal stuff, the objectives. Our objectives are on the screen. If any of you are in an educational role or have ever been in a role where education and or training was part of your repertoire, you know that there are objectives, and they're just a necessary part of any educational endeavor. Our objectives for today are up on the screen. Pretty much you can read them as you will, but basically our goals and our objectives for today is to share with you our experiences with TeamSTEPPS and how we implemented TeamSTEPPS into our facilities with non-traditional methodologies. A lot of fun and some unique training exercises. Disclosures, the next one. Sadly, we have nothing to disclose. Like most, if not all of you, we are among the working poor. We're not going to be able to go out and buy a house or a boat or a new car after today's presentation, and we'll be back at work tomorrow and the next day and the next day, just like all of you guys are.
So we're going
So thanks, Dan, for that disclosure. So coming on to as to what is that we plan on sharing today, we utilize educational games as part of delivery of TeamSTEPPS, or to augment the delivery of TeamSTEPPS in our setting. And as fellow educators and trainers, you appreciate the challenge of being able to disseminate TeamSTEPPS among teams, especially among adult learners, being able to have it in a way where they can relate to that experience and see how TeamSTEPPS can be applied. So what we utilized is we utilized educational games to be able to augment the learning. And so as far as education games, and especially in the field of healthcare, so what are educational games? And so there is a review, Cochrane review, that was published in 2013, which looked into studies which were published in the field of educational games for healthcare professionals. And what was noted is what is considered an educational game is an instructional method requiring the learner to participate in a competitive activity with preset rules. So more in a fun setting where they can, and there's a kind of a competition going on, be able to have a clear objective of what we are trying to accomplish as part of the game. And so the basis, or the framework underlying this, is that of the experiential learning, right? So many of us are familiar with the adult learning model of experiential learning, where we as adults would like to have an experience, be able to reflect on the experience and see as to what we gain from that experience. And this is what we used with TeamSTEPPS even in our setting, of how we utilize simulation in our setting to be able to, for them to have that experience, reflect on that experience, and to gain from it. So what we experimented with is to utilize the education game model to implement TeamSTEPPS, or to give an overview of TeamSTEPPS, and then use that as a stepping stone for further experiential learning through simulation and beyond. So going into the theory behind as to the experiential learning, Knowles, as far back as in 1970, recognized the value of games as far as learning goes. And all of us have a kid inside who wants to be competitive, fun, and the games give us a modality where we can participate in these events in a fun setting and be able to reflect on that setting. So the four basic principles are: adults are autonomous and self-directed, right? So we like to have a control of the learning, and playing or participating in a team or game setting allows us to be able to feel a better control of the learning atmosphere. And it also provides that feeling of being a safe setting where it's not judgmental. And even in simulation, we have the challenge, right? Especially for the novice folks, when they participate in simulation, there is that fear that they'll be judged by their performance. So there is some reluctance to be able to participate. But when it comes to a game, it opens up folks and be able to wholeheartedly embrace that experience and participate in it. And we also very much use past experiences as a resource of our learning. And games allow us to be able to utilize our past experiences to participate in those games and enjoy that experience. And we are also goal-oriented. Most adults are goal-oriented. I see Kelly looking at me, so I guess I should say most women are goal-oriented. We try our part as well. And organized games help adults to attain the learning goals. And the games also allow this concept of being problem-centered rather than content-centered, right? And that probably would help us relate to real-life experiences better than in a setting where we need to sit in the classroom and help to disseminate principles. Participating in a game in a non-judgmental way, in a safe setting, along with your folks that you work with, gives us that opportunity to be able to relate to real-life setting where you work with your colleagues. So how is this more effective, right? With educational games, the learners experiment with decision making and problem solving, right? And we talked about the risk-free setting, and it's an active learning environment. It's not that you're sitting and when it's a game, you get that competitive spirit going. You try to contribute together as a member of the team and be able to actively participate without feeling that you'd be judged. The same way, we are more open to be able to reflect on a game and share our experiences and discuss about the game as to what went well and what didn't go well and what we would have done differently, which is what we hope to do with experiential learning, right? Where we want to be able to reflect on the experience and see what is that we can take away from that experience. And they also make it a fun and exciting way and to reduce stress and anxiety. Very consistent with this is what we as a group experienced as well, that participating in a team setting and having games as a educational modality help to build the team resilience of the team, right? And trust each other and be able to have it in a safe setting where you take that opportunity to laugh at each other and have a laugh at yourself and gain out of that experience. But all of this is true when games have a clear purpose of why and how that game has been structured, right? Having a clear objective of how do you relate a TeamSTEPPS a tool or a strategy and marry it to a game and be able to reflect on that. And what we did is we used this as a template or a framework where we use the educational games as the stepping stone. Once we had the games, we reflected on those games and then had a simulation exercise of a more clinical setting to see how we can take the same principles and apply it in a clinical setting. And what we recognized is people were embracing that kind of transition much more smoothly than having to get them to directly participate in a more educational setting. So with that being said, we'll follow this with illustrations of how we implemented this, and we'll share you illustrations of how we did it, the kind of tools and games that we utilized at the TeamSTEPPS National Conference, and we'll also share with you what the experience that we had in our emergency department during this process. So, Kelly?
Thanks, Shiva. So let's begin the race. That was our task here in our emergency department when we wanted to implement the TeamSTEPPS strategies and educate our team. Our goal was to do interprofessional education. It wasn't going to impact our organization or our unit if we educated separately, if we educated nurses, educated physicians, and then tried to be a cohesive team after the education. So we tried really hard to have all of our, everyone important to the flow of patients through our department was included in our education. We put together some small groups. We did this over the summer, which is generally our slower season in pediatric healthcare in Central Florida. And each small group went to a multitude of stations and did quick activities in their groups. They didn't get a lot of prep time or a lot of instruction, and the goal was to help them work it out, to let them work through each activity with the skills that they had.
And I just wanted to elaborate on the small group setting. So when we created the group, we truly kept it interprofessional. So just like the way it would be in an ED setting, one or two providers, physicians or nurse practitioner providers, along with 3 or 4 nurses, 1 or 2 medics, the supply tech, and the registration folks. So we made the team, and each team consisted about 6 to 8 individuals, more like 6 folks in a team. But we tried to keep the team interprofessional for them to work together just like the way they would do in a real-life setting as well.
We also added some competition between the teams. We wanted to engage and in our setting with the the type of personalities that work in our department, competition works really, really well to accomplish what we're trying to get done. So we set out and we did an 8-hour day of complete education. Started with 2 hours of straight games, and then did more reflection and game throughout the day. We then tailored that down, and we were able to do just a mini sampling of it at the conference last year. A team of 14 of our associates who had their first introduction to TeamSTEPPS at the amazing race that we did in our organization, then became leaders in our department, and we took those leaders with us to the national conference to really do a great experience for our participants. We had 30 plus participants. We put them in small groups and did just a sampling of activities. And the activities are things that we pulled from our TeamSTEPPS master trainer. It's some things that we pulled from the internet and from the literature. And we'll go through some of those activities. You'll see pictures. There's lots of fun that happened at our team here in Central Florida, as well as when we were out in Washington last year. Dan?
Okay, the T-puzzle was one that we chose for a variety of reasons. Number one, if you were not familiar with this, the general rules were the team leader or the group leader of this particular team would have a picture on a piece of paper, and that picture was what he or she had to communicate to the group without seeing what they were doing. So he or she had to look at the picture and tell them to place this color of pieces of paper. They have multiple pieces of paper on the table, and the leader was to direct them as to how to put the pieces of paper together in order to look like the picture. At the same time, those folks at the table who did not have that picture, they were not aware of what the end result would be. So they were relying solely upon the leader to describe to them which piece of paper goes where, which piece of paper gets connected to that, where and how. So it really was a communication piece. And we stumped them a little bit because the leader had the picture, but some of the different shapes on her picture were not necessarily the same color as the papers that were on the table. So it made it a little complex. They did not know that at the time. The leader did not know that, and the participants did not know that. So it was complex, although it sounds pretty simple. Make these 10 or 12 or 15 pieces of paper look like this picture, when the folks who were doing it didn't see the picture, and the leader wasn't able to see what they were doing. So it did complicate matters a little bit, but they still had a lot of fun.
And we use this really to drive home that shared mental model. And how do you get a shared mental model when maybe you're not seeing things exactly the way they are? You have this image in your head, but what the person next to you or in the room with you in a clinical situation is seeing something a little bit different. So the T-puzzle helped us drive home that shared mental model. We moved on. We did an activity. It was called an egg transport activity, and this the participants didn't know, but the eggs were hard-boiled. When we did this with our team here in Central Florida, we were outside, and the eggs were not hard-boiled, so that added just a little bit more fun and competition. But they had, you can't see from the photo, but there's a washer with some string, and you have to work as a team to balance the egg on the washer and move it. They moved it from one area of that hallway towards the cup, and they were lowering it into the bottom of the cup without breaking the egg. And in there, communication is very important, and leadership. These are individuals that had never met each other before, and within minutes they're on a team, working as a team to accomplish a goal. Go ahead, Dan.
The teamwork for this was absolutely essential. If you imagine there's 5 people in this picture, each person was holding a string, and all strings were connected to the washer. They were tied to the washer at the central point. So they're basically spokes on a wheel and the hub. The hub was the egg. and they had to walk down the hallway, take steps in certain directions, and one person had to walk backwards, one person had to walk sideways, one person had to walk forward. The word teamwork is probably hidden behind the picture, but teamwork was also a very essential part of this particular game. They had a lot of fun doing it, and they were limited with time, but they all thought the eggs, as Kelly said, were real and fresh. They were not aware that they were hard-boiled, and ironically, not a single team dropped the egg. So they didn't find out until we regrouped at the end that the eggs were hard-boiled.
The next activity that we did was what we had arranged for filler activities. So when we're working with groups, we had several groups, and we needed them to progress through their stations at the same time. So our team members, our facilitators, knew how much time they had to occupy their group before letting them move on to the next session. And to fill that, one of the activities that we did was a human knot. The human knot puts, again, strangers all holding hands in a jumbled mess, and they have to work with each other to get untangled without releasing the hands. It wasn't necessarily the most comfortable for everyone, but we had 100% participation, and if you can see from the photos, there was a lot of laughing and fun getting to know their team members in that way.
Although we had 100% participation throughout the entire day with this particular game, there was one person that stands out in my mind, a gentleman who was what many of us would call a germaphobe. And he looked at us and basically was wondering why we were going to make him hold strangers' hands for multiple minutes at a time. And here we are all in this big city. We don't know where everybody came from. We've never met each other before. But this guy, at the end of the day, probably laughed the most, and he was definitely the one who said that his favorite game was the human knot. It was kind of ironic twist, but he had a lot of fun, as did most of the other folks that were there in this particular game. And it just struck me as odd that he was the germaphobe from the beginning, and he loved that particular game the most out of all the games he did.
And again, the logistics of each of this game might vary. And especially with the human knot, many of you might have used this at your settings. And the more the number of people, the interesting the knot gets. I mean, if it is just a few people, 3 or 4, then it's not a great activity. But when there are several people in the room, then the human knot gets more interesting. So.
The next activity that we included is skipping rope, and I just want you to see that lady in the green there. She is laughing hysterically, had a ton of fun. We used this activity, a very simple child's game, but we used it for teamwork, communication, leadership. Somebody needed to be the director and direct the jumper and the rope turners. She was having a good time.
And the way the activity progressed is if they were finding it easy for 2 folks to jump in the middle, then we made the challenge as when 3 folks get in there. And there was a lot of situation monitoring as well, in the sense that when there was not enough space to spin the rope, they had to improvise to come up, take their setting, the environment they're in, and then factor in as to how they would accomplish the given task.
I don't think anyone who participated in any of these games really had an idea on what they were getting themselves into by signing up for a conference and a workshop at a conference. But I'm sure, like this lady in the green that was on the screenshot before, she mentioned to me at the end that she hadn't skipped rope in probably 30 years. So her face was worth 1,000 words on that particular picture. The next game we moved into was a Mousetrap. Originally, the thought here was there was a Mousetrap game, if you will, that basically has one person study a mousetrap and write directions by hand on a 3x5 card, and then take 2 other folks and read his or her directions to them as they set the mousetrap. And basically what we did here is we took that to the next level. We took several mousetraps, as you could see on the floor in the circles. We set them out throughout this 10 by 10 taped off area. And we explained to the folks at the very beginning, they came in with no blindfolds, obviously, and we explained to them the task getting from one side of the box to the other side of the box, walking through and around the mousetraps. We had one mousetrap that was set. The rest of them were not set. However, the participants did not know that. Once we introduced the blindfold, it got a little bit more complicated. But the one that was set was the one that our facilitator was picked up and set off to give them a little bit of a fear factor for the game. This game became one of the most challenging because you had one person wearing a blindfold and another person trying to talk them through the mousetrap box. The thing that you may not recognize just by looking at this picture is you've got 3 or 4 folks in the box with blindfolds, and then the other folks are talking. They're all talking at the same time. So the shared mental model, the person with the blindfold had to recognize their counterpart's voice and keep that particular voice in mind while they navigated the box. So we even had a couple of folks try this particular event barefoot. And once that particular person did that, the next few groups, apparently she must have talked to other folks, and we got everybody coming in and wanting to try this with bare feet. But keep in mind, none of them knew that only one mousetrap was set. So that also led to a little bit of the fear factor.
So I just want to elaborate on each of those things. So even this mousetrap exercise. So once the game was done, instead of us sharing with the participants as to what TeamSTEPPS tool was incorporated, we asked the participants to share their thoughts of which of the tools or strategies, TeamSTEPPS tools or strategies, they utilized as part of participating in that game. And it was interesting, the kind of discussion that followed during the debrief. There were some that mentioned that it was closed-loop communication, and when asked as to what they meant by closed-loop communication in that setting, what they said is this is very similar to, say, an emergency department when if there's a resuscitation happening, there is so much of so many instructions, so many people talking as part of helping in that resuscitation. But however, when you have a closed-loop communication with the person that you're communicating, you guarantee that the communication has happened clearly and perfectly. So in the same way, when there were 4 or 5 people involved there and 5 to 6 people talking on the sidelines, when you're closing the loop with your partner, being able to repeat back, saying that, okay, you want me to take 1 step to the right, correct, acknowledge that and move forward. That's a great illustration. So in each of the games, we were surprised. We created the game with an objective of 1 to 2 TeamSTEPPS tools, and it was interesting to see how the participants tried to incorporate more, or in their own way, incorporate several more tools of TeamSTEPPS to as their strategy to beat the game or navigate through the game. So that was a interesting experience as part of the debrief.
We talked a lot about how competition is important in our setting. We had a lot of groups competing against each other to win and earn more points with the speed or the quality that they completed tasks. How we wrapped up our day in a competitive fashion and to drive home the team concept, as well as to tap into each other's strengths and weaknesses, we did a minute to win it session. And this is where there are 5 activities, 5 completely different activities. Each group needs to complete the activities in a certain sequence, and only one person on the team can complete one of the activities. So at the end of this session, 90 minutes later, these strangers are now a team. They had time to brief before their minute to win it, decide which team member would be best suited for each activity, and arrange themselves in a way that they would make them most competitive to win the final challenge. So the minute to win it really drove home our team dynamics. It drove home mutual support, recognizing your team members' strengths and weaknesses. And it brought a lot of fun and cheering at the end, and it was a great way or a good note to end our conference.
Yeah, so just putting the games into your setting, or how you would relate to your setting. The challenges that many of us might face is how do we truly make it interprofessional, right? How do we make sure that the physicians, nurses, medics, respiratory therapists, allied health folks all be able to participate? And that requires a buy-in from leadership. So what we did is we said as part of our retreat that we planned, that we said that our ED leadership team needs to be the ED leadership team needs to be the first team to participate through this thing. And when both the physician leadership and nursing leaderships, although initially not sure as to what is going to be asked of them, they were open to it, and when they participated, that just opened the doors, and more and more folks participated, and we did three events on 3 separate days, and all 3 events were completely interprofessional, and there was great participation from all teams.
All right, we're going to move through some of our other slides. We're getting to the end of our time here.
But just keep in mind, folks, that all of these people were virtually strangers at the beginning of this 90-minute session, and throughout the 90-minute session, these games helped them recognize all the TeamSTEPPS components, all the tools that they could use, put them in a game atmosphere, and then they all recognized each other's strengths and played on them for the minute to win it finale, if you will. Integrating TeamSTEPPS into clinical practice, basically, you really have to do some homework in order to get the approval that you need to start moving. One of the most important things that I would say is to gather statistics from your facility or your department and start small. Pilot your plan in small departments. Gather data from before the plan. How was morale? How was the statistics or the metrics that your leaders measure? Gather that before TeamSTEPPS, before your plan gets implemented. Implement your plan and then show them the after. This is what the morale looks like now. And I could tell you the morale from the ED staff went relatively through the roof. After this, all the folks gathered together and became true leaders. The 14 folks that came from Orlando to DC became true leaders throughout this entire process. You also want to learn, in order to get the buy-in from the leadership that you need, you want to learn some of the buzzwords that they're using throughout their particular meetings and huddles and emails even. Read the emails from your leaders once in a while. It'll get some nice buzzwords to use when you make presentations or when you're trying to sell this to the leadership as a small project that can go bigger and broader later. Absolutely essential is staff level engagement. If your leaders approve, you have to get that approval first, of course, but you need to engage and involve your staff. You need to find those shining stars, and most of your team should be shining stars. However, you want to probably the stars that you have in your department or your division that may not be so bright. Their light may not shine as bright as others. You want to get a few of those folks on board too, with the objective of those folks becoming brighter by following and working with and learning from the true shining stars. But get them involved and keep them engaged. What I have here is from concept to conference. You really do need to involve them in the planning phase so they'll have buy-in themselves. And of course, we talked about financial and logistical support, which is absolutely essential. Kelly deserves a huge round of applause and credit. She put a lot of this strategy and logistics together. She was the one responsible for the creating of this, and it took a lot of detail-oriented things to put this entire thing together. The strategy that she developed has to go through with the detail. The detail is everything from where do you find a dozen eggs or 2 dozen eggs in the middle of a city when you're staying at a hotel several blocks away from anywhere. Not only that, where who and when are they going to get hard-boiled for you? Who's going to get them to your site to make sure they're there? How long does each game take? Let's play this out. Let's do a dry run. Very detail-oriented, and make sure.
Yeah.
Go ahead, Shiva.
Dan, I was just going to add, each of these activities requires a lot of planning because it's great when it works out fine, but getting there requires for you to consider the logistics of how things would happen. There was a question about how we formatted our day of events. So the way the day that we formatted was the day started out with fun games, so that it set the stage of the day being a fun day where it's going to be educational games and stuff. And following the 2 to 3 hours of fun games, we had a brief TeamSTEPPS overview of the tools and strategies, and followed by a debrief by each of those teams where they related to how they incorporated those TeamSTEPPS tools into each of those games. So as you can see, there were about 120 interprofessional associates, the ED associates, nurses, medics, providers, support staff that participated in this. And following the fun games, we went a brief overview of TeamSTEPPS tools, which probably took us 45 minutes. And then there was a 1 to 2 hour debrief that was followed by a few more games. And what we did towards the end of the day is we utilized a simulation of about 4 to 5 different scenarios, and we let them incorporate the TeamSTEPPS tools that they appreciated and incorporated during the day as part of the simulation as well. And the day ended with a 1 hour debrief of what they got out of the experience. And most of it was self-learning and based on the reflection of the day and their participation in this team fun activities.
In these pictures, we have our chief medical officer, we have our nursing leadership. These are some of the activities that we had them around the hospital. We were not in the hospital. We did happen to get in the fountain in a nearby neighborhood. Not sure how that happened, but we have photographic evidence of our team there working on mutual support. In the center photo there was the leader. He was our nurse manager of the department, and before we began the Amazing Race, he put together a Braveheart-inspired send-off and sent our teams out on their Amazing Race through their activities and really set the stage for teamwork and the learning that was going to happen that day. We threw in some other things that we were struggling with, such as Aid It and Leap, and there were those activities. We used sidewalk chalk. It was a very relaxed summer day.
If you notice, those pictures are certainly not of any ER setting. Even if it's just getting out of your normal setting, that in and of itself could be considered a non-traditional methodology.
So the outcomes of the race, we had an awareness of the TeamSTEPPS tools and strategies. It was unknown to our entire team prior to this event. We had an increase in utilization of TeamSTEPPS in our simulated training that we do here in the department. It is introduced, or it is sustained through other clinical education sessions and things that we do in everyday practice. It really made a difference in our team morale and resilience. And our patients were seeing the difference. We were seeing a jump in our Press-Ganey scores. Our patients were satisfied and happy with the services that we were providing, and it is now across our unit, and we are leaking TeamSTEPPS out into other areas of the hospital.
So on reflection of what we could have done differently is this took a lot of logistic planning, and every time there's something different that you can, or better that we could do after this exercise. One thing that we probably, the next time around when we do it, is to be able to collect data as to pre and post, as to looking at real outcomes, and being able to document and share those outcomes. We did not put enough resources in to be able to capture the data as to how this exercise directly related to the outcomes that we were interested in. But we did do a pre and post survey that looked into the team morale and their awareness of TeamSTEPPS, and there was a significant improvement on both those metrics for sure.
So there's many tools and strategies that TeamSTEPPS offers us, and you pick and choose which ones will be most applicable to your unit or your department. You customize the tools that you want and then the way in which you train your staff. Our associates really responded well to games, and this is turned into an annual event for us. We began with the Amazing Race. We carried it on this year in 2016, and we have funding to do it again in 2017. It is the difference that it makes in day-to-day practice on the unit. Just the feel of the unit is amazing during our education series. And we want to thank you all for your time. We really enjoy talking about what we do here and the difference we're making. We will hope to see you all in Cleveland in June of 2017, and I think we have some time for questions.
Sounds
I did
great.
notice on the right-hand side there, I did notice a few questions about the resources with different directions for games or instructions for each game. Kelly, you want to talk briefly about that?
Well, I think let's see what other, we can provide that after in some communication afterwards. Chris, do you want to guide us?
That's entirely fine. If there's anything that you want to get out to the folks that were on the webinar, we can definitely help with that. But we have lots of other questions too that are in here, and I just wanted to, seeing some of the questions, I just wanted to clarify the fact that you guys were talking about two different things throughout the course of the webinar. There was your staff training at the hospital that took a long period of time, and then you were doing a 90-minute, very condensed version of this at the hotel for the national conference. When you did the conference one, did you have the same sort of ability to talk about what the TeamSTEPPS tools were, go through a brief rundown of what the essentials are, or did you focus in mostly on the games and during the debrief of each game talk about the tool?
Well, I'd like to respond to that. Because of the 90-minute time constraint, we really focused our energy in how we taught or how we introduced TeamSTEPPS. We didn't spend as much time specifically teaching the TeamSTEPPS concepts. We highlighted in the debrief which activities related to which TeamSTEPPS tool, but the conference didn't allow time to actually teach the concept. We were teaching the game.
And the learners or the attendees as part of the workshop were well versed with the TeamSTEPPS tools and strategies. It was to show a framework of how a fun or educational game modality can be incorporated to disseminate TeamSTEPPS in their settings. So that was the objective behind the workshop. So the learners were different in both the settings. So when it came to our emergency department, it was a group who were novices at the beginning of our training, and now there's greater awareness of TeamSTEPPS tools and strategies among our team now.
Sure. Traditional to TeamSTEPPS, we did do a general debrief right before the minute to win it, and then we also did another minor debrief right after the minute to win it, and both of those debriefs talked about, you guys just used a ton of TeamSTEPPS tools. So the general debriefing, like Kelly said, we did not have enough time to do that after each game. We had very little time in between the sessions. Every group of teams rotated through every station to get the experience, so we didn't have that time to do that.
I would like to comment on some of these questions. Charlene, this was an 8-hour day at the hospital. However, we did tailor it to 90 minutes at the conference. The other question was who attended the team building. In our department, it was our top leadership to our very end users. We had our supply techs, our paramedics, our nurses, our nurse practitioners, our physicians, our physician leadership, nursing leadership. Every single person in our department participated in interdisciplinary teams. The leaders were mixed in with the end users. There was no differentiation in hierarchy. We just really worked hard to make each team interprofessional.
Yeah, the team stayed together. Each team was created from the very beginning, and that was another unique thing. As they entered the room, they were given a color-coded card, and then they were escorted to that table. They did not know who was going to be on each other's teams. They were entered, given the card, and they sat at the table that responded or corresponded to their color. So all these folks had no idea who they were teaming up with, but those teams stayed the same team throughout all the rotations. And also, we didn't have to really prepare them other than giving them a few minutes of introduction to the games themselves. We didn't really, since it was a TeamSTEPPS conference, they knew that they were going to get something TeamSTEPPS out of this workshop. However, at the end, we tied in all the TeamSTEPPS tools that we utilized into our two debriefs.
Could you imagine using pretty much your 90-minute presentation with people who had no TeamSTEPPS background? So let's say somebody is walking into a department that really they know, maybe they've heard of the tools, they know what's going on in their hospital, or maybe they're walking into a, ambulatory, setting of some sort or an office, and they're going to say, hey, we want to introduce you to TeamSTEPPS, and we're going to do it using only these games for 90 minutes. Would that work, do you think?
Yeah, so Chris, I'll take that question. So this is the challenge of any educator, right? I mean, say even when we are giving a PowerPoint presentation, when you're given a 30-minute time frame to provide a presentation, when you start out a presentation, you end up with having 120 slides for a 30-minute presentation. So we want to cram in a lot of details into a shorter duration of thing, but it definitely can be accomplished when we have the bigger goal in mind. The key is to plan it in such a way that it does not feel rushed, because the most of the learning happens during the debrief of being on a reflection on the game and stuff. So as compared to selecting several games, you might select 2 games and be able to rotate your participants through those 2 games and give them an opportunity to have that period of self-reflection, provide an overview of the TeamSTEPPS goals, and show as to how they related those tools and strategies as part of those games, and further moderate that discussion to see as to how that would relate to their practice of medicine, or in their setting as to how it would relate to. Can it be done? It can be done, but it's definitely challenging. As like I said, as educators, we try to we try to get it all across. It just needs to be done in a way that we keep in mind that most of the learning happens during the reflective aspect of it, for that debrief, that there is sufficient time so that it doesn't look like a rushed fun activity, and that is just it. So,
got it. Did you happen to, before you had done this 8-hour day at your hospital, had you ever done training TeamSTEPPS in a less game-oriented situation? I guess the question here is really, did you do any sort of data collection between doing this with the games and without the games, especially on the line of using something like Kirkpatrick's model, which is about the reaction, learning, behavior, and results?
So, good question. So that was one of the drawbacks of our thing, in the sense that we did not have the resources to be able to get a pre and post evaluation done with that intervention that was provided. So the way this manifested was our team that was familiar with TeamSTEPPS attended a master training course, came back from the master training course. We debriefed as to what we learned from the course, and then we thought as to, in an ED setting, with the challenges of having to build the resilience of a team and be able to incorporate the TeamSTEPPS, as to what would be a best modality to be able to incorporate those. And based on the brainstorming that followed the master training course, we decided to make a case with our leadership of arranging a retreat and making a themed retreat, saying that it was an amazing race or a survivor kind of retreat, and structure an educational program that would incorporate games to be able to do it. What we would have done differently is being able to utilize an evaluation tool to have done a pre and a post and be able to share our results. But other than a pre and a post survey that we utilized to look into the TeamSTEPPS awareness and morale, we did not get an opportunity to look at it as a structured intervention.
Got it. And I guess the last kind of closing question is, with implementation in mind, going into your day, the Amazing Race Day, had you already discussed with leadership, or did you have certain particular tools that you really wanted people to, let's say, start debriefing after an event in the ED? Or was there something in mind already, or was this more of a, let's get everybody comfortable with the tools and then we can talk about implementation afterwards?
We wanted to introduce the tools, and we did focus on the debrief and the brief.
Got it.
At the same, so once everyone was introduced to the tools, we focused on call out, check back, brief, debrief, and closed loop communication. And we do simulation training in our emergency department. We have resuscitation rooms, and we're using the TeamSTEPPS tool, those specific tools, during our resuscitations, and then debriefing and doing a formal data collection of the impact that we're having in our resuscitation.
Just to quickly elaborate on that, as far as a simulation, we changed our simulation title from having to say ED clinical simulation to saying TeamSTEPPS simulation. So our focus and objectives for each of the simulation sessions is to focus on the TeamSTEPPS, a specific TeamSTEPPS tool for the simulation exercise. But although we had 2 or 3 simulation tools in mind, what happened as part of the event is people started relating to different tools that were incorporated. So it worked out as a great overview.
Got it. Well, we're at the top of the hour here, so I'd like to really thank all 3 of you for being here, doing this, both at the conference and having a chance to do this webinar, and all the great work you're doing at your hospitals as well. I ask everybody that joined today to please fill out evaluations that will be coming out to you, but we really thank you all for joining and listening in as well. So with that, I'd like to sign off, and everybody have a really wonderful rest of your day.
Thank you, ladies and gentlemen. This concludes today's conference. You may now disconnect your lines.